Hey everybody, hope you are doing well. Hey, my name is Sam. I'm coming back with another video. I almost didn't really want to make this video because I was not in a very good mood. So what happened is a month ago I had a shoulder revision surgery because I had a rotator cuff torn, and I had to go in and the doctor had to remove all the hardware. And I had my initial shoulder replacement, actually both of them, in 2010, 2011. But recently I just had a rotator cuff tear. It's killing me with the pain. And on the right shoulder was a standard replacement back in 2010. So in order for the doctor to fix the rotator cuff, he has to go in here and remove all the hardware from previously, and then put in a reverse implant in here, a reverse hardware. So the amount of work done is actually quite tremendous. It's a very big surgery. Why am I so depressed? I actually had the surgery on August 1st, 2024, and today is exactly 4 weeks away from the surgery. So as of day one, I have mentioned this to you on the forum. I'm joined on the ankylosing spondylitis forum on Facebook as well as Reddit, and probably some people remember what I had mentioned to them is that after the surgery, I have completely lost sensation and functionality to my arm, to my right arm, all the way down to the fingers. And up till this point, a month away, I still do not have any mobility on it. So it looks like it's just dead weight. So there is a great deal of nerve damage. It technically should not happen. And my doctor is generally the surgeon. He's only a shoulder, arm, shoulder, and elbow and hand doctor. So he's more of a specialized doctor that technically deals with all these all the time. But I don't know how I got this. I've been reading up on the internet. It's a really rare occasion that someone would have a nerve damage, and generally it would come back in a couple of days or a few days or so. But it's been prolonged to been a month already, and it's been scaring the bejesus out of me. So that's why I was not really reluctant to make this video. So I'm quite depressed and a little bit concerned that if it doesn't comes back, and you know how nerve regeneration is extremely slow, and you can never know that it's going to be permanent or not. If it's permanent, then that would be the worst thing possible that can happen, doing the surgery, besides dying. I don't know what is worse, because if somebody goes into surgery and die, basically, if it happens to me, I will not be able to worry about my hands not being functional. My arm is, being paralyzed, and I don't have to think about not being able to use my arms anymore. But since I did not die, this to me is actually the worst case scenario if this becomes permanent, and that's very scary. Ankylosing spondylitis itself is already bad enough. I had so many different medical workups already. I had 2 hips replaced in 1995 and 96, and I was 20 something years old. Yeah, it was really bad. And then I have both shoulders replaced. That's how much damage the ankylosing spondylitis can do. It just really eats up all the tissues. And I go in here to go to the doctor to get this replaced so it can fix me up for the better, not to go in there for the worse, right? So yeah, so that is extremely frustrating. Now in the beginning, it happened since day one. I could not move the finger since day one, and they have the nerve block from the neck here. This is where all the nerves coming down. That's controlling the the arm and hands, the functionality and sensation. And the nerve block was kept on here for 4 days. Now I thought it was just because the nerve block, and once it's removed after 4 days, and a week later, I still do not have any mobilities or sensation. That's when I actually get scared. But at least the surgeon is, he is willing to see me whenever I needed to, and he know that it's one of these rare occasions that it damaged the nerve. You just don't know how bad it is. I mean, it's bad enough that I have no mobility and no functionality on my hands already, right? And so last week, he ordered a ultrasound to make sure that the nerves are not cut. But technically, it should not cut the nerves because these surgeons that he's in and out, day in, day out, and they know exactly where to cut. And he went into the same cut as my previous incision from 2010, 2011. I don't know which one came first. So he went into the same place. But I guess the amount of work that needs to be done is when he opened this up, he had to push my arm to the side. That needs to expose the hardware that's in there. He had to remove the previous hardware and then put in some new one here. And it did a reverse implant. So I understand the amount of work, but at the same time, I think he could be a little more careful with the arm, the nerves and all that. Having a little bit of nerve damage is fairly normal, and the arms become a little bit immobilized for a day or two is actually quite normal. But anything, longer than that, that is pretty much kind of unacceptable. And I guess it's the nerves has been pulled, stretched, or whatever it happens. Let me show you what this looked like. It is swollen right now. See this? I have no functionality on my fingers. I cannot bend it. I cannot do anything. And this area, the weight just kind of drops off. As you can see, this hand, you can hold this up, you can do this, but there's nothing I can do with it. I can feel some of the sensations. It feels weird, it feels different. It's not the same. And down here, it's quite soft. The muscles are not there. The surgery is, the cut that's from here. So much bigger. I don't want to show it to you. It's kind of looking, actually it's okay. It doesn't look so bad. So that's the cut right there. Up here still feel a little quite okay, but back here feels weird, feels different, feels numbing. Oh, the pain is actually pretty bad, pretty excruciating. There's a bit of nerve pain running alongside of here, as well as this side, and the back of the elbow here. It's quite painful during the night. It wakes me up. My God, I have not been getting a good sleep for the last 2-3 weeks, and I'm just extremely tired. Not to mention the amount of anxiety, depression, the stress that goes with it. It's just horrible. I do have anxiety disorder, and I used to take medication for that. I have some benzodiazepine that kind of keeps me calm, but I have not touched any of the those antidepressant medication for more than 6 months already. So I just had to take a couple of these pills to keep myself straight. Otherwise, I just pretty much going crazy. It's just the thought of losing the arm it's pretty scary, because this is my predominant arm. Everything I do is with the right hand. I can't even go to the bank right now. I can't sign my name. So, which is quite a problem. I am referred to see another doctor, more focused on the nerves, in a couple of days. And the surgeon will be ordering a nerve conduct test. He said I need to wait till 6 weeks before you do the nerve conduct test. Otherwise, it's too soon. So I'm going to get that in a couple more weeks, and hopefully they can isolate where the actual damages are. And I don't know if they can look into it to see if there's other way of looking into to see if there's, how bad is the damage. Nerves grows extremely slow, so a month already, and I have very slight improvement. So if it even comes back, it's going to take months to a year or so. So that's quite frustrating. 2 weeks ago, he gave me a regimen of steroids. So was hoping that was more of an inflammation with the nerves that can cause the immobility. But after I took the week of steroid, it's still been the same. So the ultrasound was the way to go, because doctor said they can run an MRI, but the MRI would be a problem because this area is all the hardware is in there. The MRI will see this area just more like a white area, but they cannot see the details. So the ultrasound can run through this area and following the nerves all the way down to the elbow. A lot of people suggest that I would actually go to see another doctor to get a second opinion. I did call a couple of doctors. This is a different surgeon that did my shoulders. My initial was done in a different group, and I gave them a call. They were so busy, I left a message for 3 days already. They have not called me back. And I talked to a different neurologist, and the appointment for that neurologist is 2.5 months out. And I can't wait that long. This surgeon is still allowing me to order some. He would allow to order some tests. I guess he is concerned as I am as well. I did saw a different neurologist, not that great of a neurologist doctor, but I went and get some opinion from him, and he gave me all the ins and outs. These nerves can grow very slowly. There's a possibility that it could be permanent, but generally it should come back. Gives me a little bit of assurance. And he said he actually pointed me back to my surgeon, and he told me to have him order some more tests, like the nerve conduct test and all that stuff. That will be ordered in a couple more weeks. Long story short, this is definitely a surgery that has gone wrong. I'm hoping over times that things are going to come back. At this particular moment, I can't expect to come that it's going to be healed by tomorrow. Even for however many months, as long as I can get back to 80-90% of the functionality, I'll be happy. I cannot be expecting a whole lot at the moment. Well, sorry about that. This video seems like it's just more of a complaint than anything. Just want to get an update. Hopefully whoever is doing a shoulder surgery, what you want to do is you want to mention this to your doctor. I know you're going to have a different team or anesthesia team that's going to tell you you're going to do a nerve block here or whatever it is. Question them. Make sure that that it whatever they do, they need to be very careful and try not to damage your nerve. And then mention that to your doctor. I actually did not have this experience when I did the first 2 surgery. So when I went in there and to do this, I did not mention to my doctor to be careful with the nerve damage or nerve injury. So a little information for you if you are going into any of these shoulder surgeries. Shoulder has more nerves on here than the hips. The hips, they can run alongside. The buttocks area that does not have any nerves. And I had a hip surgery 4 months ago. It's been working out great. I'm feeling it like it's my own now. But the shoulder, there's a lot of nerves alongside the area. So as long as if they stretch it, it can be a problem. So you want to remind or mention that to your doctor to have them be very careful with it and not to cause any nerve damage. Okay, I'm hoping that mine will come back soon, and hopefully I'll have more good news for you when the next time I create another video. Anyway, thank you for watching. I'll see you on the next one.